2017 marked the 50th year of Barbados becoming a member state of the Pan American Health Organization and the World Health Organization. Over the years, PAHO WHO Barbados office has been working with countries throughout the Caribbean region to improve and protect the health of its people. Although the average person may not be aware of PAHO's work, people in the Caribbean have benefited from the improvements in health over the last 50 years. As we adapt to the changing needs of member countries, an effort was made to improve the effectiveness of technical cooperation delivered by the organization.
In 2006, the Pan American Health Organization decided to increase its country presence in Barbados and the Eastern Caribbean. This was done through the creation of the PAHO WHO office for Barbados and the Eastern Caribbean. This office covers the 6 Organization of Eastern Caribbean states, namely Antigua and Barbuda, Dominica, Grenada, St. Vincent and the Grenadines, St. Kitts and Nevis, and St. Lucia, the 3 UK overseas territories, Anguilla, the British Virgin Islands, and Montserrat, and the 3 French departments in the Caribbean, namely Martinique and Guadeloupe in the Caribbean Sea, and French Guiana in South America. The work of the Pan American Health Organization is further strengthened through the 7 country offices that are based in the Eastern Caribbean. We have an office in each of the member states of the OECS, as well as a coordinating office in Anguilla that deals with the UK overseas territories. The work of the World Health Organization and Pan American Health Organization is namely with the Ministries of Health.
As Minister of Health in Barbados, I want to join in congratulating the Pan American Health Organization as they celebrate the 50-year partnership with the Ministry of Health here in Barbados, and to salute the work which they have led, not only in Barbados, of course, but in the region. Successive directors of PAHO have paid very special attention to the healthcare systems and services which are offered in our region, strengthening our various ministries of health, and in particular, the healthcare workers spread across our country. Our chief medical officers and our senior medical officers have all benefited from significant training, either in the region or in the developed world, so as to hone their skills to allow them to be able to contribute even better at home.
We get training through PAHO. We work in areas like maternal and child health. We get assistance with our NCD clinic, even with our TB program, which we have already achieved the 2030 Millennium Goals for that. We have already closed them, right? We work our EPA program, expanded program on immunization. We do get assistance from PAHO with that. And they also provide training in those areas. So like you say, generally speaking, I would say before PAHO, there's no health. And in an effort, like you said, to really achieve our goals, that is why we do all the way PAHO helps us with the training. Right now, there's a training going on where we're developing strategies for adolescent health, because what we realize is that we've been focusing a lot on maternal and child health, the younger child, the pregnant woman, but then we forget after the child reaches a certain age, what happens. So right now, we're in the process of actually developing those goals, and those goals will be working in line with the Ministry of Health strategic plan for the year up to 2021. So we're in that process, and that training would have been on within the last 2 days that we would have had that training with PAHO.
We have been able to achieve progress specifically in areas of vaccination, so that the region and Barbados have essentially eliminated diseases like smallpox, rubella, and other contagious diseases. Our Vector program has also been stimulated by leadership from the Pan American Health Organization. And this has allowed us to contain the spread of viruses such as the recently noted Zika. Of course, we would have had before that chikungunya and dengue fever. And we want to certainly salute them and their successive directors for the kind of care that has been given to the regional program, and specifically the program here in Barbados.
However, we also work with other ministries of government, with the University of the West Indies, and non-governmental organizations such as the Healthy Caribbean Coalition. Our work focuses on 5 main areas. We work in communicable diseases such as the eradication of mother-to-child transmission of HIV/AIDS, the elimination and the reduction of the effects of mosquito-borne diseases such as Zika and chikungunya. We also work with governments for the prevention and management of non-communicable diseases such as diabetes, cancer, and high blood pressure, as well as working to improve the health of all the family, and specifically children and adolescents. All of this is done through the strengthening of health services and systems. Another role that the Pan American Health Organization has in the Caribbean and from the Office of Barbados and the Eastern Caribbean is that of helping member states increase their preparedness for natural disasters that we know occur in this region. We help countries in the management of disasters and especially in the first response of the health services once a disaster has occurred in a country. The Pan American Health Organization and World Health Organization, in collaboration with all the governments of the Eastern Caribbean and Barbados, strives to improve the health of every citizen of this region.
PAHO is committed to ensuring that all people have access to the health care they need, when they need it, with high quality and without fear of falling into poverty. Through its work, PAHO promotes and supports the right of everyone to good health.